Hi guys, we have a patient with right flank pain in this example. Let's just quickly scroll down to see if something catches our eyes. In the lung basis, I didn't see a pleural effusion, consolidations, pneumothorax. Let's go to soft tissue window. We don't see much of the heart. This is a non-contrast CT. We don't see any contrast in the aorta or in the vessels in the liver. The non-contrast appearance of the liver looks okay. Pancreas okay. Gallbladder overall looks okay. When I scroll down and if I compare my right kidney to the left kidney, you can kind of appreciate how the right kidney has a subtle enlargement. It's just slightly bigger than the left kidney. It's slightly hypodense, and there is hydronephrosis in the right kidney. Now, sometimes people do have prominent extrarenal pelvis. The way I'm telling it hydronephrosis is more by looking at the calyces somewhere around here. See how it's almost hard to um, see it here, but here is just like big and dilated. So we have right-sided hydronephrosis. So my next thought is that is there an obstructing stone in the ureters, given the history, especially of right flank pain. The ureter is dilated too, so this is our left ureter right here, and our right ureter it's much more bigger. As you scroll down, right as the ureter passes over the iliac vessels, right here there's a stone. And distal to this, the ureter is decompressed. And let's go down more. The ureter inserts into the bladder somewhere here. I do not see any stone in the bladder. Let's follow the left-sided kidney for the sake of completeness. I did see a small calyceal tip stone right here. We do see this stone sometimes often, and clinically, I don't think they have much significance other than the fact that they could come out and go to the ureter and cause pain. But I think when they're just inside the kidney like that, I don't know if it causes any symptoms or if it's clinically relevant in any ways. So I'm following the left ureter right here. It's diving down, crosses the iliac vessels here. And as I go down, there is no stone on the left side. We do have excretory phase images. So what these are is that we give IV contrast and wait 8 to 10 minutes so that now the contrast is all in the renal collecting system. And here it's even easier to appreciate on the left side, the calyx. You can almost kind of see, comes out, goes back in, comes out, kind of like this V shape, which is what we're supposed to see. And here the calyx are all blunted. So again, right-sided hydronephrosis, layering contrast in the renal pelvis, and almost none of the contrast made it to the ureter. And scrolling down, again, we do see this obstructing kidney stone. And in this post-contrast images, we do see slight enhancement of the ureter just proximal to the stone. Does it mean much? I mean, not necessarily. It's just like increased blood flow to the ureter at that place. Um, and we have in coronal, and in coronal, it's actually easier to appreciate hydronephrosis more easily than in the axial images. Again, we can compare the renal calyces and see how sharp these are. The way I was described to it was that you should be able to pick one of these uh, tip of the calyx and sort of like pick your teeth after eating food with this. That's how sharp we want them to be normally. And especially if you look on this side, these calyx are really blunted and there's hydronephrosis. And again, we see the ureter down here, and there's the obstructing kidney stone. Um, and one other thing I just saw, I'll just show it to you, is that on the left we can see jet from the jet of urine kind of going into the bladder right there. Doesn't mean much. I don't think we always see it. We sometimes see it, we sometimes don't see it. But that's the diagnosis in this case is an obstructing kidney stone on the right side with hydronephrosis. At this point, I would, go back and follow my search pattern with liver, spleen, pancreas, and look at all the organs. Thanks for watching this video.